I want to tell you about 6 disasters that didn't happen. 6 times in the last year, a disease outbreak that could have become an epidemic, something that kills a lot of people, shuts down economies, fills hospitals, disrupts people's lives, stopped. And it didn't stop because of luck. It stopped because there's people that you've never heard of doing work that you've never seen, all culminating together at the right moment to extinguish a nascent outbreak. There's a new report out called Epidemics That Didn't Happen. And I think it's a really important document in public health. Not because it's dramatic, it's the opposite of dramatic. It's about the invisible work that keeps the world running. So the report is built around something called 717. So what's that mean? It's a pretty simple idea. You want to detect something when it emerges within 7 days. You want to report it up the chain in 1 day and have a response underway within another 7 days. So that's like 2 weeks from first signal to containment. It sounds obvious, but most of the times that's not what happens. It takes longer and longer. Think about the outbreak of Ebola in the DRC. That probably went on for months before anybody noticed. Or the hantavirus outbreak on the Hondia ship, 23 days before they actually realized they had hantavirus on their ship. Now, this group called Resolve to Save Lives that put out this report. It's run by the former CDC director, Tom Frieden, who also was the New York City Commissioner of Health before that, and spans 90 different countries. And the data shows you exactly what you would expect. When you detect something fast, you can extinguish it. It doesn't happen. It doesn't metastasize. And if something is not contained, you get what's happening in the DRC. I'm going to give you some of the examples that they cite in their report. So number one, El Salvador, malaria-free country. They started getting imported cases in people who had traveled to malaria areas that had malaria. Using 717, they identified them, got labs, contained it, kept malaria-free status. Gabon. In the middle of the Mpox public health emergency, they ended up having an outbreak, spotted it fast, and just kept it to 2 cases, 0 deaths. South Sudan. This is an area where there's lots of issues that compound infectious disease threats. They had a cholera outbreak there. What you saw was one of the fastest team deployments from the Ministry of Health had ever done there, because they'd arranged the way they could flexibly fund this to be able to scale up pretty quick. Money could move very, very fast, less bureaucracy. 6 cases, South Sudan, cholera. Thailand, cholera outbreak again, near the Myanmar border. Cross-border things, much more complicated, politically sensitive. Thailand contained 10 cases, 0 deaths, using coordination mechanisms they had set up before. Uganda, Ebola. Prior outbreaks have occurred there. They've got cases there now. They were able to contain an outbreak earlier on very quickly and easily because of these systems that they had put in place. And then interestingly, and this kind of maybe will dovetail with what's going on with the World Cup, is during the Cricket World Cup, the Caribbean Public Health Agency ran a digital surveillance system across multiple islands, looking for kind of real-time signals to detect for travelers, for residents, for health systems. It works. The cricket tournament, no outbreaks. But there's a deeper point here, and this is kind of what I want to understand. These successes are invisible by design. When the outbreak doesn't happen, nobody really cheers, nobody cares, nobody even knew about it. When a healthcare worker makes the right call in the first 72 hours, they don't usually get an award. When a malaria case doesn't turn into a cluster, the people who don't get malaria don't even know that they were at risk or that they were protected. And I wrote about this before. I had a Substack post talking about infectious disease physicians and public health workers sort of being civilization's guardians, and they're often unseen. The work they do, surveillance, diagnostics, rapid response, exists so that normal life can continue. So you don't have disruption. You can go to work. You can take your kids to school. You can watch cricket or watch the World Cup. That normal life is not the default. It has to be continually defended by infectious disease physicians, by epidemiologists, by public health workers. It's being defended all the time by people you don't really ever see or meet. And I think it matters now more than it normally would, because we're in this situation where we've got deliberate dismantling. CDC surveillance gutted, global health funding slashed, wastewater genomic surveillance kind of flailing. And the Epidemics That Didn't Happen report is proof of concept for the value, how it allows normal life to continue, allows people to flourish. It's not a theoretical benefit. It's actual concrete risk reduction. And I think that you really need to think through how public health works in order to value it. And I think this type of a report is really, really instructive. Just remember that when we're talking about infectious diseases, we're trying to free you from them. We're trying to give you freedom from infectious diseases. We are trying to protect civilization, whether or not you notice or not.